And you feel that virtual reality can help mitigate the existing barriers within current psychedelic protocols? Can you provide more information on that?
Sure. I think there are two problems with the way psychedelic therapy is now. And I say problems, being a bit facetious there, but I think the optimal model is not scalable, and the scalable model is not optimal. So the way psychedelic therapy happens mostly now is to fit it into the medical model of therapy, because that's what's scalable. The optimal model, which is how it's been used for centuries, which is a more retreat model. It's a nature-based scenario. It's a more shamanistic model. It requires far more immersion. Is just not scalable. There are huge resource issues.
Right.
And for us, virtual reality is a means of, one, increasing the optimization of that therapy, but providing a therapeutic tool that the therapist can utilize, like I said, that pulls that patient back, increases the connection and the anchoring, and also increases the scalability by, in the manner of acting as a therapeutic tool, can reduce the amount of therapist time that is required. Two, the integration process is usually quite circumscribed as being like sort of 6 to 10 sessions. It's not very long. And after that, the patients are sort of left after the end of the clinical trial. By producing over those six weeks a whole package of data, of qualitative information that they have produced for themselves, which they can then take as a package along to any therapist who wasn't even present in those during those sessions, who can then continue that integration and psychotherapy with them, because the patient comes to them with this whole virtual world where all of the insights, everything that has happened in the last 6 weeks is sort of represented and you can access. Reduces the burden on clinical trials and psychedelic therapy institutions from having to provide that extended care. And it means they can provide that care to a far faster turnover of cohort of patients.
Amazing. We should back up and kind of explain that we are talking about psychedelics, but for the most part around the world, psilocybin and ayahuasca and these other kind of therapeutic psychedelics are illegal for the most part, right? In America here, we are able to, under the guise of religion, use ayahuasca, but there's nothing like that for psilocybin or for cannabis or anything like that.
Yeah, the RFRA in America is a very interesting thing. So the RFRA does
just for our audience, RFIA is?
The restricted, oh man, I should know this. The Restricted Freedom to Religious Use Act. Oh. I'm probably butchering that.
Oh, okay.
It's an act. It's the act in America which allows for religious exemptions to certain practices.
Right.
Because you can classify it under religious use.
Here, Native Americans are able to use peyote. That's another
for example.
Right.
Or the Santo Daime Church with ayahuasca. Right.
Yes.
But as much as the RFRA allows for that, the DEA still remains very silent on the subject, which continues to place it in the gray area and continues to not, it's not something that happens with the full and thorough auspices of the law.
Right.
Which is unfortunate, but
and it must be very difficult then to actually do these trials and produce this data and present it to a medical organization, all under the guise of the actual substance being illegal.
It is. It becomes incredibly tricky, resource intensive, and expensive. I went to a research institution that was running these trials and talked about how they had to go through so many layers of permits, right, to get the drug in. And then once the substance is in the research institution, it has to be in a locked safe, which is in a double locked room, which is down a corridor which has security cameras, behind a triple locked door with a security guard. You get the whole deal in this super secure building. But you walk out of that building, you turn right, and the university campus is surrounded by a state forest. And you walk about 200 meters and you walk into that forest, and it's sort of right there in the ground. Like the irony is inescapable. But having said that, the pharmaceutical grade substance is required if you want to maintain scientific integrity into the empirical method. And as much as I hate the fact that the illegality puts this many constraints on it, and that the regulatory status does, the world isn't ready for psychedelics to just be sort of flushly available everywhere. Like, these are incredibly powerful and potent substances, but as a result, also incredibly dangerous. And Alfred Nobel, when he invented gunpowder, was terrified of what the consequences would be. And sorry, I say gunpowder. I mean, I'm talking about atomic energy. And he was terrified of what the consequences would be, and justifiably so, because anything this powerful is also extremely dangerous when not wielded safely.
But now,
And
they're really, I mean, if we look at it, in terms of, overdoses, and that doesn't really happen with psychedelics. I mean, yes, you could wind up,
no,
you could take a bunch and you could have a bad trip and, you could need possible, medication or mental issues may arrive from that if you've really
yes,
overdosed yourself. But we're not talking about like heroin or cocaine or things like where if you
no.
really, you really max out, you could be dead. That doesn't really happen with psilocybin, does it?
The psychological safety profile of psychedelics is, it's absurdly safe. It's one of the. I often think of psilocybin as the safest drug I'll ever prescribe, physiologically. There's no overdose potential. There's
No
really no
addiction,
addiction potential.
right?
Sorry, yeah.
There's no addiction potential, right?
No, and no statistically significant in an increased rate of mental illness between psychedelic users and non-psychedelic users. This was like a 150,000 person respondent survey. However, the potential psychological harm that can be created and the not just psychological harm, but the risk of abuse. You're creating really vulnerable situations. Patients who are undergoing this are incredibly raw and psychologically vulnerable during that time, right? Which is why it's so efficacious. Something that can open you up that much, such that if I'm going to use really raw analogies, so you can dive in and explore your soft, mushy insides that you call your psyche, is going to leave you really raw and exposed. Which means you need an incredibly safe container. You need incredibly strong controls around those containers to ensure that this is being administered and conducted safely and properly.
Right.
And research is often the first path towards sort of shepherding us into that future.